Breast and cervical cancer. Oh, that is a national program. There's a program in every state, and we're really proud of the work that's being done through the partnerships statewide between our program and all of the provider sites, clinics all across South Carolina that are doing their best to serve South Carolina women in working to promote education, promote early screenings to combat and prevent breast cancer and cervical cancer for South Carolina patients. So, like I said, there's a program in every state. The South Carolina program is known as Best Chance Network, and we are affiliated with the Department of Public Health. So, some quick information, and and everybody consider anybody that's joining us today. Might have some interested providers, or there might be patients, potential partnerships. We're hoping to give you some background information about Best Chance Network to start with. As I mentioned, we are a part of the South Carolina Department of Public Health. We used to be with DHEC. DHEC is no more. It's been a little bit over a year since DHEC split, and we have joined the side of the Department of Public Health. We are located in the cancer program section. The main purpose of our program is to be that reimbursement source for women in South Carolina for their breast screenings and their cervical screenings to prevent, again, late stage cancer. It is a nationwide program. Every one of our 50 states does have a program that's affiliated with the national program. We were one of the first states to be funded and approved by Congress in 1991. We are currently in our 35th year of existence, and we rely on a CDC grant. We have federal funding, we have state funding to serve as that payer source for women in South Carolina to have their services covered. Now, we do have over 500 participating providers statewide, and then we have some located in North Carolina, some located in Georgia to help those South Carolina patients that might be on border counties. Directly for Charleston, we have 37 locations that we're contracted with that participate with Best Chance Network, and we have 111 locations in the Low Country that participate. And that includes primary care locations that can be, some of the MUSC primary care sites, some of those affiliated with larger health systems, and then a lot of independent ran clinics or facilities that are doing wonderful services for South Carolina women. We partner with the big ones, MUSC, Trident, Roper. They're doing those high valued services, screening mammograms, 3D mammography, ultrasounds, diagnostic services, anything that those high dollar services that women need for their breast and cervical services. They participate with us and we reimburse them on behalf of patients. Why is my slide not going? Okay, there we go. So a quick outline, and I apologize for all the wording on there. It's really hard for us to be short. But everything that we cover, some services we cover during the primary care visits, we cover clinical breast exams, we cover PAPs, pelvic exams. So, the main focus this month is always going to be for breast cancer prevention, but we still like to urge, providers to have those conversations with patients, keeping in mind, in October, it's a big focus for breast, but don't forget about having your cervical cancer prevention services. We go down the line covering those primary care visits for patients that are 40 and above, or if they have a strong family history, if they have previous abnormalities. We cover those mammogram services. If they have any sort of abnormalities that are detected during their primary care visit, we can proceed on and we can cover those diagnostic services for patients. That includes biopsies, any sort of invasive procedures. Also on the flip side for cervical abnormalities, we cover LEEP procedures, colposcopies, not to be misconfused with colonoscopies. We cover colposcopies. Pretty much anything that a patient needs pre-diagnosis. There is another, and we do assist patients with getting enrolled in this program. There's another program within South Carolina that helps patients if they have a breast cancer or cervical cancer diagnosis, and that's through the BCCP Medicaid program. So really from start to finish, we try and make it a really accommodating process for South Carolina women to give them plenty of options. The considering the eligibility for our program to be able to help patients, first of which women must be a South Carolina resident. Um, the age range is 21 to 64, but breaking it down, we do start coverage for breast cancer screenings at the age of 30, unless there's a strong family history or if she's currently symptomatic, we can go a little earlier than that. We have a little bit of flexibility. And it goes up to the age of 64 because at the age of 65, typically patients will be covered by Medicare for their annual breast and cervical screenings. 21 is a little bit younger for cervical cancer because we are seeing more of a higher incidence with younger ladies getting cervical cancer. So we want to start that a little bit earlier than breast cancer. The next requirement, they do have to be at or below 250% of the federal poverty limit. This verification of their eligibility is completed on the provider side. So ladies can bring in a income statement, a proof of income, and as long as they meet the federal poverty level, they can qualify for our program. And a lot of patients don't have any form of insurance, and we take over as the primary payer source to be able to cover their services. But if they do have a Blue Cross Blue Shield plan, or if they have Medicaid, some sort of plan that covers some of it but doesn't cover all of it, if they are South Carolina resident within the age ranges and meet the income requirements, we can actually take over as the primary payer source and cover all of their screening and diagnostic services. So uninsured or partially insured, we can help out. All of the enrollment for Best Chance Network is completed at the individual locations. And as I mentioned, we have over 500 locations that participate in the Best Chance Network program. They enroll patients on their side in the clinic and they use prior authorization codes. And not to bore everybody too much with the details, it's just a simple approval code that says from your first visit, your routine office visit, you're covered at least for a year to have your routine visit, any sort of revisits at that primary care site, your imaging services, and then God forbid you have an abnormality. Our program also links that to the prior authorization code. And again, MUSC, Trident, Roper, any of those big facilities, they can cover your biopsies, any sort of invasive procedures. It's done every year. A lady just goes into a practice, gets their eligibility confirmed, and they'll get enrolled in our program for a year's worth of coverage. Um, every provider actually works directly with our staff in-house. We have a billing department that works very efficiently to make sure that the providers are being paid in a timely manner. Providers work with us, we pay, and the patients should ideally never experience a bill. And then, of course, we handle troubleshooting if they do kind of slip through the cracks, and we'll make sure that those women are handled and still have a positive experience. I do have a few contact information of our primary staff. My team is the regional provider coordinator team for the Best Chance Network. We primarily work directly with our provider network of over 500 providers. Elizabeth Gonzalez is kind of new. She's our low country provider. If any interested providers, partners, anybody wants to reach out, you can give her a call, shoot her an email. But my information is listed in the top left-hand corner. I am the team lead, so I can help out wherever needs to be, wherever needs be, wherever needs attention. I also do have my upstate and my PD coverage, RPC listed as well. I highly encourage anybody listening in, take a picture of this, send us an email, give us a call. You can visit our website. We had a redesign of our DPH website, and it's very interactive. It's very self-serve for patients and providers and any interested parties. You can just simply go online, search Best Chance Network South Carolina. If you're a provider that's not currently partnered with us, send us an email, give us a call, and let us know, and we would love to get you onboarded. If you're a patient, we do have a self-service tool on there that you can actually see a full list of all of our participating provider offices and it includes the addresses and it does include the primary phone numbers. It should be as simple to just call the practice and say, hey, I'm a patient that doesn't have insurance. I'm kind of struggling financially. What do you have that can help me with my breast and cervical services? And we work to make sure that those providers are informed about our program and they should give you a positive experience. If you have any issues, you can give us a phone call, you can shoot us an email, and we'll troubleshoot that with the provider office and get you into the practice that you want to go to. Get you to a primary care site, get you referred over to your imaging services, and then if you have any abnormalities, also do those tests for you as well. Everything you should need is on our website, but like I said, shoot us an email, give us a phone call. We're happy to help you out. Also on our website, we have a materials section. Anybody joining today that's interested in our program, and if you want to share this with your patients, with other partnerships, we have flyers listed on there. It can take you to our phone number, our email address. Everything's listed at the bottom. There's a QR code again that'll take you to our website. Has all of our eligibility requirements that are listed on there. Print these out, hang these in your facility, hang these in your practice, whatever. Share these with patients. They're listed on the website. You can just easily print them off. At the same time, we also do have a little help sheet that lists our income requirements and how to follow those in order to find out if your patients or if you have friends, family members, that to see if they qualify. This is based on family size. So if a woman is interested, she has to consider if she has any dependents, if she's married, whatever you guys would do, your gross household income, if it meets that requirement, you'll qualify for Best Chance Network. And I'll also mention it's not a one-time enrollment. As long as you qualify for Best Chance Network, we can help you financially every year. And in closing, I have our contact information. I kind of wanted to keep this brief for y'all. I do have Selena Lowry as our Best Chance Network Program Director. She's also accepting any sort of inquiries via email or phone. You can reach out to her as well. But our purpose of today, like I said, any sort of interested providers, partnerships, if any patients are listening in today, hopefully we can provide a little bit of insight, some resources for you in this very critical month of Breast Cancer Awareness Month. Please keep in mind it's equally as important to have your cervical services done as well on a timely manner. We want to give you these tools, offer this to you, that you're not having a large gap in between your routine women's wellness exams. Have these services done every year. And if you don't have, you're having sort of financial or insurance challenges, use us as a tool. We are your part of the national program. We exist to serve South Carolina patients. So I'll turn it back to y'all if you guys have any questions, if I can expand on anything. I apologize, I don't have more statistics or anything to go over. Really, my approval was to go over the Best Chance Network program, but I can answer any general questions if you have anything for me.
Yeah, thank you so much, Christopher. Great information, helpful for us. We appreciate it. Any questions for Christopher? I guess I have a question real quick. I wanted to check. You had said that in most cases they have to meet the income level, but if they're uninsured completely, do they still need to meet the income?
Yeah, so the basic criteria is they have to be a South Carolina resident, and I'll just explain that briefly. There's a program in every state, so if they are a Georgia resident, North Carolina resident, they go to a provider that's located in their state, and the funding covers the patient, whatever resident they are, whatever state resident. They have to be a South Carolina resident between the ages of 21 to 64. Otherwise, we'll review it, and likely we can cover patients younger than 21, over than 64 in some cases, but they do have to either have no insurance or have an insurance plan with a high deductible that's $1,000 or higher, limited coverage that in combination with having a low income, if it doesn't cover the service 100%, we can review it, review the request, or if they have hospitalization only insurance coverage. We get a lot of Medicaid patients. Medicaid will cover the primary care visit, but it doesn't always cover the mammogram or the diagnostics. And patients may not be so interested consistently in getting enrolled in our program on the front end, but once they have that abnormality and they see the costs associated with having diagnostic mammograms, biopsies, colposcopies, they can see, oh wow, these are very expensive procedures, and that's where our funding could step in and help out those ladies with those high dollar services.
Great. Okay, thank you. Any other questions? Christopher, thank you very much. And Christopher is with the South Carolina Department of Public Health. Is that correct, Christopher?
That's correct. Yes, sir.
So we appreciate all the work that you do, and thank you for sharing with us this morning. Thank you.
Thank you all. Have a wonderful day. Thank you so much.
All right, you too, and you're welcome to stay on. We've got some more meeting. If you need to go, we certainly understand either way. So, want to go to our community health update and call on Dr. Katie Richardson, our Low Country Regional Medical Director.
Thank you, Councilman Shealy. I first want to talk about our Fast Track Cities initiative. So I've presented on this before and had some colleagues as well, but this is basically an initiative that the city of Charleston and Mayor Tecklenburg signed on to back in 2019. And the idea is the it's a international group of cities that are working to end the HIV epidemic across our country and around the world. And we've been actively involved here in Charleston, both honoring World AIDS Day every year by having educational sessions, by testing throughout the city throughout the year with free testing for HIV. We've had initiatives to address stigma around those who are living with HIV, as well as add risk for it, and have also promoted education on HIV prevention, both medical means as well as behavioral interventions. And recently, the Fast Track Cities Convention was held in New Orleans, and as part of that conference this year, two of our own from the Ryan White Clinic at MUSC presented on some of that community testing that MUSC, our Tri-County SHAPE initiative, and partners have been doing in the Charleston area. Prior to that, at the last virtual summit, the director of the Roper St. Francis Health Services Center presented on some of the innovative work that they have done around housing as to address the social determinant of health of housing as it relates to those living with HIV being able to begin treatment and stay in treatment to basically be able to live a normal lifespan now. HIV's really moved into the world of chronic diseases or chronic conditions similar to diabetes. And with proper treatment, people can live a normal length and quality of life. And so I bring to this committee today, and Paul shared, I think yesterday, maybe 2 days ago, that out of that conference that was in New Orleans, a new resolution was brought forth. And that resolution really outlined the commitment of Fast Track cities across the world to shared values of equity, solidarity, resilience, accountability, and dignity, with the commitments to sustain political will, protect resources, strengthen community partnerships, advance integrated person-centered care, and combat stigma and discrimination with the promotion of U equals U, which stands for undetectable equals untransmittable. Or the idea that for those living with HIV, if they're on treatment for their HIV, their viral load is undetectable, that they are not they do not transmit HIV to their partners and their community. So the virus is not transmittable to others if those living with HIV are on treatment and their virus is suppressed. And so IAPAC, which is the group that really supports the Fast Track Cities initiative, it calls on stakeholders to sign on to this commitment as we continue to advocate for funding HIV programming, again, both prevention as well as treatment, as the avenue for ending the HIV epidemic. And so I bring to this committee a request that we I make a motion that this committee recommend to make Mayor Cogswell that we continue our support, the City of Charleston support of the Fast Track Cities by signing this resolution and joining mayors across the world in recommitting to the importance of addressing the HIV epidemic in our midst. And so Paul is sharing that resolution. Again, Mayor Tecklenburg signed several of these declarations or resolutions, some in person and some some in person, during summits. And some outside of that, but just sort of recommitting Charleston to working to end the HIV epidemic. So happy to take any questions about that. I guess I'll turn it over to Councilman Shealy or Paul to say sort of what next steps are, but this is the resolution. If you couldn't read it or you want to read it more closely, again, Paul sent it out yesterday, I believe. Any questions about this?
So Dr. Richardson has made a motion for us to recommend Mayor Cogswell to sign this resolution. Do I have a second on that?
Yes, this is Dr. Kay Durst. I second it.
All right,
Thank
so
you.
Dr. Durst, thank you for seconding that. So we've got a motion to approve asking Mayor Cogswell to sign this resolution, and we've got a second now from Dr. Durst. Any further discussion? All right, if not, all in favor of this, please signify by saying aye. Aye.
Aye. Aye.
Yeah.
Aye.
Are there any opposed? If not, the ayes have it. So Paul and I will bring this forward to Mayor Cogswell and see if we can talk him into signing this resolution. And thank you very much, Dr. Richardson, for bringing that to us. And yeah, we'll move that forward and see what we can do on this. So, Dr. Richardson, do you have any further on your reports this morning?
I do. Thank you
Okay.
very much for that. And if Mayor Cogswell would like to meet with members of Tri-County SHAPE and the Fast Track Cities Initiative, please let me know. We'd be happy to gather in person or for a video call to do that.
Thank you.
I feel like immunizations has been my other topic over the past several months. And so I'd like to spend a few minutes on that. A lot has happened over the past month around immunizations. And much of that has been around the COVID-19 vaccination and approvals and recommendations. And so I'd like to start with saying that the South Carolina Board of Medical Examiners in mid-September gave authorization to pharmacists, pharmacy techs, and others to administer the COVID-19 vaccine without a prescription. So we talked last month that there was a lot of confusion and uncertainty around who would be able to receive the COVID-19 vaccination this year and how. And we are grateful that the Board of Medical Examiners did decide to say that South Carolina would not be requiring a prescription this year, and that through what we call shared decision making, or speaking to your provider or a member of the pharmacy staff, that anyone 6 months and older who meets certain recommendations, including the American Academy of Pediatrics recommending the COVID-19 vaccine for all young children ages 6 to 23 months of age, and those that are older with medical conditions that might make them at greater risk, or who live in a household with someone who may be at greater risk for COVID-19. Like side effects or consequences. ACOG, which is the Obstetric and Gynecologic Association, is recommending the COVID-19 vaccine at any point during pregnancy, when planning to become pregnant, in the postpartum period, or when breastfeeding. And then various other groups are recommending the vaccine for anyone ages 65 and over, as well as those under the age of 65 with risk factors. So I encourage you to speak with your provider, speak with your pharmacist. The vaccine should be available. Insurance should cover it. Most people do choose to get their COVID-19 vaccine through pharmacies, but certainly feel free to call your provider and ask if it is available then as well. We are happy to see that the COVID-19 numbers have begun to go down, but every year we've seen a bump around the holidays. And so October and November is a good time if you haven't had COVID-19 in the past 4 to 6 months to consider getting vaccinated prior to the holiday season. So that's COVID-19. Flu is still recommended by all bodies, including the CDC and all of these physician organizations, for everyone 6 months of age and older. I do recommend getting it in October if you have not already. Last year, unfortunately, flu hospitalizations, as we talked about here, were higher than any year since 2010. We know that the flu vaccine on average decreases the risk of needing to go see the doctor about a respiratory infection by somewhere between 30 to 60%. Even those who may get the flu after having the vaccine have a milder case than if they had not. And then finally, I want to end up with RSV, or respiratory syncytial virus. This is the leading cause of infants needing to be hospitalized here in the United States. This is also RSV season, just like the flu and the COVID-19 spike around the holidays. And RSV vaccine is recommended for pregnant women as well as those over the age of 60. Those ages 50 to 64 with potential chronic medical conditions. If pregnant women do not get vaccinated during their third trimester, there is a monoclonal antibody, which is not exactly a vaccine, more of a preventive medicine that is given as an injection, and that can help protect infants from RSV if the mom getting the vaccine protects the infant through antibodies for the infant's first 6 months of life, or the monoclonal antibody does the same thing for infants. So I think I'll stop there. I know that's a lot of information about vaccines. Happy to take any questions about that or any other topic right now. And as always, I really appreciate you giving me this space to present some public health information. Thank you.
Thank you, Dr. Richardson. Any questions?
Katie, I always have to ask the question, how did the flu do across the other side of the world this year?
We think that it's a pretty good match. I have not seen projections about how rough we feel like the flu is going to be, this year in North America compared to South America. But what we know is that it was really a difficult year last year. And so we certainly don't want to see that repeated. So we do feel like the flu vaccine is helpful every year, sometimes more, sometimes less, but we feel like this year it should be on the more helpful side in preventing flu infections as well as the severe consequences of flu for our communities.
And I know that you said this last month, but so the schools are doing their own thing. DHEC has got will have flu shots sometime.
That's right. So I think beginning the 8th of October, we will begin having flu vaccines available. Those can be obtained with an appointment to in our immunization clinics. Pharmacies have had them for quite a while now, and they are free of charge for basically everyone, almost everyone with insurance. And they're starting to be more community flu clinics as well. DPH, Department of Public Health, does not yet have those scheduled because we feel like we need to get it in our clinics and get our own employees vaccinated, but we will certainly provide that information as we have it. And I know that MUSC and Roper St. Francis are also, gearing up. Our free health clinics have flu vaccines as well. So flu vaccines should be readily available in your community.
And the COVID and RSV are at the primary cares.
Yes, I mean, they're also available at pharmacies for adults and older children. Most pharmacies in South Carolina do not vaccinate young children. And providers, you really just need to call your provider and ask. Some are carrying, almost everyone, I think, carries the flu vaccine. Some are carrying the RSV and the COVID vaccine. And Dr. Durst can tell us more about sort of her understanding of coverage, in the Charleston area in providers' offices for those, but they should be readily available in pharmacies, if not also at your provider, and they should be covered as a preventive measure by most insurances.
And one more question, and then I will let everybody else have a conversation. We're seeing it advertised now that you can get a flu shot in the mail or a flu nasal spray. Is that coming from? I hope that's coming from pharmacists.
So I actually should do some more research on that. I have seen it. I do believe that it is the nasal, the flu vaccine that is a nasal spray. We've had that for quite a few years. That is a live virus vaccine. So it's not for everyone, like pregnant women or the immunocompromised. It's not the best choice for a flu vaccine. There are other safer choices. But yes, that is available, I think, for the first time this year. And I think that's something that you should talk to your provider about. We definitely recommend flu vaccine. And if that's most convenient for you, I think it's great to have that as an option.
Thank you.
Lisa Burbidge?
Yeah, hey Katie, just a quick question on RSV. Is that like a shingles shot where you take it once and that's it?
Yes. Yeah. So it's only recommended once. Shingles is actually 2 doses, but one time. RSV is actually just one shot, one time.
Okay.
Yeah. So that it should provide years of coverage with that one vaccine.
Okay, thank you.
Yes.
Any other questions or comments on this?
No, I
Okay.
just,
Yep, go ahead, Dr.
sorry,
Durst.
but yes, thank you. Yeah, I just was going to follow up what Katie said at a lot of the offices. I know that even through Roper, a lot of us have the COVID-19 vaccine, and I know that MUSC and independent doctors. The main issue is, just call the doctor's offices, most of them being covered, especially with some insurances, but they have it, they'll let you know there. It's just really a supply and demand issue. But like Katie said, you can get a lot of them at the pharmacies. Definitely the flu vaccine in most doctors' offices are readily available. So thank you, Katie, for updating us with that. Thank you, Commissioner
Thank-
Shealy.
Thank you very much. Any other questions? Well, thank you again, Dr. Richardson. Great information that we all needed to hear. So I appreciate you sharing this morning. Thank you so much. So, all right, and we'll move on to our community health and wellness updates. And I'll just kind of let y'all raise your hand or jump in if you have something to contribute for us.
Well, we might as well let Nick tell us about how much money he made with the walk for hunger event.
Yeah, Nick, jump in there.
Thanks, Paul. Thanks, Councilman Shealy as well. Yeah, and thanks to everyone for sort of sharing the details for the walk. Yeah, we had a very successful walk. This year we did it on Saturday instead of Sunday, which seemed to attract more people. At least that's our sense anyway. But no, it was a great opportunity. We had over 300 people. I think, Paul, as you shared, we had 300 people turning up. And we were able to raise close to $100,000 as a result of it as well. So great show up from our community. I think for us, one thing that was really interesting and very important as well was the proportion of our younger population as well showing up as well. So again, just talking about sharing issues that our neighbors face around hunger and food insecurity, but also an opportunity for our other partners to also come together and table their own and talk about their own organizations as well. So a great gathering. And as I said, we felt that it was very successful this year. The weather was great as well, which is always a benefit. But again, thanks to everyone for supporting that. And again, it's not just about raising money, it's also about raising awareness and sharing the importance of understanding some of the challenges that our neighbors face, whether it be food insecurity, but also other issues that face our neighbors every single day.
Wow, congratulations, Nick, and thanks for all your efforts. That's outstanding. That's really, really good work. Thank you. All right. Anyone else for community health and wellness updates? Anyone want to share?
Yeah, Councilman Shealy, I just wanted to share that NAMI walk is happening on the 11th, Saturday of this month, up in Somerville. And then the Walk Out of Darkness, the American Foundation for Suicide Prevention, that annual walk is occurring on the Sunday, the 26th, up in also near in Somerville. I have the flyers. I can send them to Paul. But again, similar to what Nick was sharing, it's raising awareness, also raising funds, but raising awareness about mental health, mental illness, and well-being. So always enjoy attending those. It's a great community event. And I know the AFSP walk on Sunday the 26th, they had to move to a bigger park last year. So it's been in a number of different areas in the Tri-County. And last year was one of the largest walks that they had. So really looking forward to supporting that as well. So I'll get the flyers out. Would love to see people out there. Thank you.
Great. Thank you so much for sharing. Appreciate that.
Yes, sir.
Hey, Kevin, Morgan put this in the screen, so I'm gonna let Morgan just give it another pitch.
Hey y'all, thanks for all the updates so far. I'm on the board for Charleston Moves, which is an organization that promotes safe walking, biking, and public transit across the region. And we have our big fundraiser in November. It's Thursday, November 6th at Edmonds Oast in the outside space. So it's our 20th anniversary of the organization, and a lot of good advocacy and great projects going on right now with the Ashley River Crossing, the Low Country Low Line, among others. So tickets, if you want to attend, they're inclusive of food and drink. There's an auction. You don't have to be present for the auction. So if you want to share with anyone, there's lots of great local artists, great local fun things in Charleston, music tickets for Daniel Island tennis. So if you want to share that with anyone that might want to bid, they don't have to attend. I'd appreciate that. So this keeps the advocacy and keeping safe biking, walking, and public transit at the forefront of transportation and recreation projects in our region. Thank you.
Thank you, Morgan. That's charlestonmoves.org. Is where they go on there. Is that correct?
Yes, that's correct.
Okay. Very good. Well, thank you for sharing that. All right. Anyone else? Well, if there's nothing, oh, Dr. Durst.
Oh, hi. Sorry about that. I was trying to get off my Zoom. Yeah, I'm so excited and thank you so much for everybody's time. And especially we talked about the Breast Cancer Awareness Month, but I love all these walks coming on. So I kind of feel, I think it's awesome. We're getting out there and promoting wellness. And there's also another walk that we're doing this weekend. The Charleston Medical Society has a group of doctors that helping walking, getting the doctors out in the community. It's the Isle of Palms walk this Saturday for helping with children with abuse. So that's important. Also, we had our school health and wellness committee meeting with Dr. Janice Key and Dr. Catherine Oates, our leaders with that. And I'm very excited to say we've started off the new year. We have some great projects that are coming. At this last City and Wellness meeting we had, and I'm sorry if I mispronounced her name, Keish, I believe, with the police department out there. She's on our committee now and helping promoting wellness and safety for in the schools. So we're just starting our wellness program where we had our competition last year and we're working towards working with the schools, and the Charleston County has wonderful nurses. We have a charge nurse and wonderful people on their team. If you are interested in being on that, we could reach out to me or Dr. Janice Key. You don't have to be a physician. We do have nurses and people that are here on this meeting on that. But that's important. And I know I talked about last time we had the Low Country Jazz Festival. For those of y'all that know, that was Dr. Thaddeus Bell, who's won multiple awards, which he started the foundation for closing the gap in healthcare with disparities in healthcare. And for those of y'all went and the Gilliard paired up with that, it was a wonderful success. It was a sold out event, and the money that was raised for that goes to his organization, which is also a collaboration with the Charleston County Medical Society. So thank you for your time, and thanks for promoting that and being participant. It was a great collaboration with the city of Charleston and the Gilliard.
Great.
Thank you.
Thank you, Dr. Durst. Appreciate that. Oh, let me just ask you, the Isle of Palms walk, do you need to pre-register or is it something you can show
I
up
think the
to?
registration is still open.
Okay.
We did ours through a different group registration where we have medical students, residents, and doctors. I'm not sure. I sent Paul, I think, the information. I'll have to look it up. I think it's still open.
Okay.
So it's a
Great.
run and walk. They go over the Isle of Palms. So also be aware because they do go over the Isle of Palms connector, I believe, to Seaside Farms, and also there will be some traffic.
Okay, great. Thank you so much. Appreciate that.
Good, thank you.
All right. Anyone else? Well, Morgan, you popped up on there. I don't know if you weren't. Okay. All right. All right. Well, if there's nothing else to come before this committee, I want to thank everybody for a great meeting, a lot of good information. And if there's nothing else, we stand adjourned. Thank you so much.
Thank you, Councilman. Thank you, Paul.